Hi, everybody. Thank you so much for joining our panel today about public health careers. My name's Abby, and I'm really excited to be moderating this panel today. For those of you who are tuning in with Millie for the first time, we're a company dedicated to building a global community for students all over the world. So we host these panels and webinars every Saturday. And if you're interested in any future events, give us a follow on Instagram at Millie_group, and there we'll put all of our updates on upcoming events and panels. So for today's panel, we have prepared some questions already, but please feel free to submit your own questions in the Q&A in the chat bar. They can be directed towards one panelist or both to do with public health careers. So for the start of the panel, we'll go through our own questions and then we'll bring your questions in as and when they come up. So we encourage you to ask any questions you might have to do with the panel, applications, the career. And today we have two really interesting panelists from different kind of sides of the industry. So we will get started with some introductions from them. Could each panelist please introduce themselves by telling your name, the city you are in and from, your job role and where you work, and one fun fact about yourself. We'll start with Freeman.
Hello, everyone, and thanks for joining. My name is Freeman Lewis, and I am currently located in Port St. Lucie, Florida. I'm originally from Berkeley, California, so the other side of the United States. And I am currently in a doctoral program at the Robert Stemple School of Public Health at Florida International University. I also am serving as the Director of Operations for Nucleate Florida chapter. And a fun fact about myself is that I have a 5-year-old Siberian Husky and a 2-year-old Siamese kitten.
Thanks, Freeman. Hi, everyone. Nice to meet you all. My name is Juliana Saracino. I go by Julie. I am currently based in Washington, D.C., but I'm from a small town in North Carolina in the U.S. Right now, I work at Palladium. It's a consulting firm, social impact company, and I'm a health financing associate. And one fun fact is that I just returned from a 3-week trip in Indonesia, and that was my first time in Asia.
Amazing. That sounds really cool. I will start off with some questions kind of about your jobs, just so the students can get an idea of what you do really. So could you explain a little more about what the job is that you do, and also the company that you work for, kind of what do they do, and what does your day-to-day entail?
Yeah, so I think that my previous role before starting my PhD program is more relevant for this conversation because of the experience and the amount of time that I spent with that company. I'm relatively new to Nucleate as of 2 weeks ago, so still onboarding and understanding the systems there. But prior to joining my PhD, I was working in San Francisco for a biotech startup called Calico Life Sciences, and we were doing research on aging and age-related diseases. It was a very research-based role. I was contributing to the development of our preclinical packaging for our drug therapies that we were researching. For potential commercialization and use in the clinical setting.
So I currently work, like I said, at Palladium as a health financing associate. I've been here for about 2 years, and I've worked similar jobs in the past. Being based in DC, it's contract work, and meaning I contract for government contracts. So a lot of the funding that we receive comes from USAID, the U.S. Agency for International Development, or Global Fund, or FCDO in the UK. And what that means is we implement their programs. So we apply for a grant, we win that funding, and then we have like 5 to 7 year contracts and such. And as in the associate role, I am on multiple projects and play a role in certain of the in each of those, and I just divide up my time, or what we call LOE, um, to work on those projects. But I play a similar role for each one. So I, for example, will do some research and write an advocacy brief based on the research I found. I'll do some quantitative analysis just in Excel or sometimes data, write that up and work on a paper with someone. I will put together a lot of PowerPoint decks and send those off to government stakeholders and try to persuade them to like get on board with the program, or just explain why, for example, for the Indonesia program I'm working on, we're trying to promote women's health insurance activation. And so we're trying to get buy-in from the National Health Insurance Agency about why our program and why our technical assistance will help promote the reactivation of women into the health insurance scheme. So it's a lot of background research of like what global best practices in health insurance look like what like health insurance statistics, things like that. So it's a mix of quantitative and qualitative research. And then see more about the day-to-day is that it's a mix of meetings with other team members, very collaborative, and then also a lot of self-directed work. So a lot of that research or putting together a slide deck I'll do by myself, but then I'll have a meeting with team members and we'll be brainstorming for putting together a framework, or brainstorming how to prepare for a meeting with a government stakeholder. So and I would say I've been in a similar role at RTI International a couple years ago, doing also some contract work, but US-based health policy, and it was a similar sort of setup.
Thank you. So it sounds like the day-to-day can really vary. And we have a third panelist who's joined us. Hello, welcome. Would you like to introduce yourself by telling us your name, the city you are in and from, your job role and kind of where you're working, and one fun fact about yourself?
Sure. Sorry, I'm late. Hi, everyone. My name is Amani Altel. So I am currently working in New York. However, my current job is based out of Boston. I just graduated from Columbia University from the MPH program. And currently my job role, which I just started on Tuesday, is a global health education coordinator with Global Smile Foundation. So they're an organization that's basically their main goal is to provide like cleft lip and cleft palate care for underserved communities. And they recently started focusing on a global health aspect, just focused on like patient-related outcomes, how to best reach the underserved populations in different areas that they work in, etc. So that's where my role kind of steps in. I'm gonna start doing a lot of research with them. They have a few research fellows that I'm gonna be working on, just mainly like research manuscripts with. And then my other role is they have, or not my other role, same role, but kind of like added on to it. They have an educational workshop that runs every year, and that's in a different location every year. So this year it's going to be in Barcelona, and it basically brings in like a bunch of providers, whether that's surgeons, nurses, orthodontists, general dentists, etc. And they kind of provide a educational workshop for the providers. So a lot of that has already been planned since it is coming up in November, but I'm kind of stepping in to see what are the best practices, or what can we add to the educational workshop that can kind of improve how the workshop has been implemented in the past. Just looking at a bunch of surveys that we had from the past, see what can be added onto the workshop that's happening in November, and then also creating a bunch of new surveys to kind of evaluate the workshop that's going to happen in the fall. And one fun fact about myself, is I signed up for a marathon, which I'm currently practicing to run, and I have never ran a marathon before or any race before. So wish me luck.
Congratulations on your new job, and wow, that
Thank
is
you.
a so good luck in your training. It sounds great.
Thank you.
Now we've kind of had a bit of a background of what you do for work and what the roles entail. I think because our students will be at the point maybe in applications and thinking, you know, which course should I do to then go into a career that I'm interested in? I'd be interested to know about your studies. So, what did you study? It could be one degree or postgraduate as well, and kind of what led you to picking that course? What made you think I want to study this when you left high school? We'll carry on with the same order, so we'll start with Freeman again.
Yes, thank you. So I, in my undergraduate training, went to the University of California, Davis, and studied physiological psychology. My interests were in health research, but I wanted to include a broad training in disease-associated research and ensure that I had a strong foundational background in biology, as well as in physiology. So it was a good major that provided me with a strong foundation. In postgraduate studies, I went to Tulane University, where I received a master's in public health in social behavioral and population sciences. So at the time I began the program, it was when COVID was impacting the globe. And this training afforded me a skill set in epidemiology and population-based research. So kind of integrating these two skill sets was my goal at a global level, but then also at an individual level, devising health strategies that communities could utilize to reach their full health potential. I am now pursuing a doctorate degree, again at Florida International University and the Robert Stemple School of Public Health. My training is under the environmental health sciences and the brain behavior and environment program. I have narrowed in on central nervous system pathologies as my disease area of interest. And I am interested in using, sorry, that's my dog in the background. I'm interested in using mass spectrometry-based omics in order to identify novel disease biomarkers for central nervous system pathologies. What I would say, my progression through my training has been dependent upon where I see the need within society at the time. We are now at a point in which we are collecting mass amounts of data at a systems biology level, and we need researchers who can integrate that data in order to make novel discoveries of how we should treat diseases. And so that is where I'm at in my training, but that would be my advice, is how to approach career or programs, academic programs. Look at what the market need is at that time and try to anticipate what public health will need within the next 5 to 10 years.
So for me, when I was graduating high school, I intended to study international relations because I love traveling, love learning languages, love learning about cultures. So I chose global studies when I went to the University of North Carolina at Chapel Hill, and it wasn't until my sophomore year that I declared global health as a major, and I had medical anthropology as a minor because I was, like I said, very interested in cultural approaches and ways cultures make meaning about their health, and I love the social justice aspect of health as well. But it wasn't until sophomore year that I chose global health because UNC has such a robust health program. So I was able to take some classes at the UNC School of Public Health, and that kind of distilled my interest in global health. But while at university, I took more of like political science, anthropological coursework, and so I didn't have any biological sciences or data sciences like Freeman's talking about. Like I didn't have the biostats or epidemiology training, and so that's what led me to pursue the master's in public health at Johns Hopkins. I still So the program I did there was international health, and I focused in health systems because the work I did between undergrad and graduate school was abroad, working at local organizations in East Africa, and so I wanted, and just seeing how like resource-strapped areas um, need more input at a systematic level, and so that's what made me want to focus on health systems and not something so capital P public health like epidemiology or something like that. But I still knew to be in the field I would need that kind of that training. But I will say that said, if you're coming from, say you do undergrad and you already have like biostats, FB, you already have some global health lens, a master's in public health is maybe not going to add much value to you. The value it does add is having the master's next to your name, honestly, and having that network of people at an institution that offers the MPH. Because what really matters, what I found is that what really matters is the skills that you do have. So if you do graduate with really excellent skills in biostats, that's great. But if you already have that coming in, it might be better to think of other degrees like an MBA or something. You can still work in public health with an MBA. And I was finding too, networking for jobs when I was leaving graduate school, people like Gates Foundation recruiters would be like, oh, we love having MBAs because we want people coming in and telling us how to be more efficient with our care delivery. We want people to be really good at marketing public health. And so these kinds of things you might not be getting in an MPH degree. And so for me, I kind of wish I did a bit more research before going straight into an MPH, which was kind of similar to my undergrad degree, and thinking about how I could be more diverse and respond to market need like Freeman is explaining.
Thank you, everyone. Yeah, I think I've had a similar experience to both Freeman and Juliana. First of all, for examples of university degrees or like postgraduate courses that that one may take, I think it really I feel like public health is so broad. It really depends on what aspect you choose to focus on. I feel like whether it's either an undergraduate or graduate, like you have a general degree in public health or whether you have a master in public health, that like term is so broad. And I feel like depending on what university you choose to like pursue your degree in, a lot of them are like split up into multiple departments. So like for me, for example, when I chose to go into my master in public health at Columbia University, I had to choose which department I wanted to be in. And for the departments that we had, it was like varying from epidemiology, biostats, population, family health, et cetera, et cetera. And that I will say does really differ in a master's. Like you do have the option of getting to choose. In my bachelor's degree, however, I didn't get to choose that. I was just a general public health student like many others. I don't know if different universities have that option of like going into different departments in undergraduate, but at University of Massachusetts in Amherst, it really didn't. And the way that I kind of knew what I wanted to do in my Master's of Public Health was because of like, I kind of looked back at what classes I was most interested in undergrad. So I know I really enjoyed global health. Epidemiology was like not, I found really interesting, but like I wasn't really good at it. So I feel like I just wanted to kind of step away from epidemiology, even though after COVID, we saw like a crazy need for epidemiology, and epidemiologists were just very, very looked like seeked, but I couldn't, I was like, no, I couldn't do it personally. But if you can, and you have the passion for epidemiology, you have the passion for biostatistics, 100% go for it. And I think also, as mentioned, really kind of see what is needed in the market right now. Like Juliana mentioned, I wish I did a little bit of more research about like MBA or MHA, Master of Business Administration, Master of Health Administration. I kind of didn't really know that I could stay in the public health field if I were to choose those. But again, that's because I feel like I didn't do as much research as needed. So I think my one piece of advice for like looking into the public health career, choosing the public health career, really it's so broad and there is something for everyone. So kind of see what exactly you can find that really chooses what you want to do, not in university, but also after university. Because when you're going to be looking for careers, you're going to be looking at like, okay, what skill set do I have? Again, the master's is just like an added name, but it really kind of evaluate like, what have you done in undergrad? What skills do you already have? What skills do you want to learn? What skills are you looking to transfer into the ideal job role that you want to have in the future? Yeah.
Thank you. It's really interesting that you've all touched upon the research, particularly kind of market research and finding what is important. And I'd like to kind of add in a question before we move on. What is the best way to do that research? So kind of the research into what's really important right now and preempting what might come. What kind of websites would you use or publications? How would you recommend is the best way for our students to actually go about that research and to find out, one, what's useful and important, and two, what their interests might be in?
Yeah, so I leverage LinkedIn heavily. LinkedIn not only can be used as a resource for the job searching, but my network posts a lot of current events and the latest in innovation or the latest in research. And so being able to synthesize the information posted from your network on LinkedIn to inform your decision-making about what is needed in the market, I think is one approach that you could use. I'm sorry, what was the second question?
Yeah, just like the best way to go about it. So I suppose decide of what's useful and also just their own interests. I mean, if they don't have a big background in it yet, how do you find out which specific areas are most interesting to you, I suppose?
Yeah, so I didn't really see how far-reaching public health was until I got into my master's in public health. But again, I think that if your network is diverse enough, implicit to that research, you will see all of the different areas that public health touches. And I mean, to be frank, a Google search about what public health opportunities, or probably looking at healthy people posts what the federal government has recognized as being public health emerging issues. that we need to prepare ourselves to be of service and help. So I think that will give you a good understanding of where the state of public health is and what areas of public health are in most need.
I will say, okay, just making sure I unmuted correctly. Okay. I will say that using people is a great resource. I'm quite shy. I hate networking. So LinkedIn has really helped with that. And I like the feature on LinkedIn where if your network likes people's posts, it brings in, you just get more exposure to different people and different jobs without, even if you don't have a big network yourself. But I will say, like say you're not in a job in a sector where you want to be, that might be a little bit trickier to know where you want to dive in, but at your current job, ask people a few levels above you, like where they worked before and what they liked about it. I used to go to I used to join listservs for global health, and then sometimes they would say, "Oh, we're having an event, sort of like a cocktail happy hour, come by." So I would attend those and then ask people higher up, like where they work, what they did, what they used to do when they were my level, how did they get to where they were. Um, and then in those conversations, they give insights kind of like we're doing today, like, oh, I kind of wish I did this, or if I could go back, I would have pursued this education instead. And one of my peers just got into her dream program. She's doing an MPP and has been working on global health. And from talking to people, she realized an MPH is not for me. I'm going to do an MPP. And she got to that decision by talking to current students exhaustively, and finding out if they like their program or not. She talked to people in our organization to ask that question of like, okay, well, if you were to go back to school now, where would you go? Or if you were to work now, what would you do? So I feel like just picking people's brains, being curious and being kind is like gets you into so many conversations, even if you are shy. And yeah, like Freeman was saying, I think I found things just by researching online. There's so much available online. Like look at posts that they collate like 10 best jobs, or where the field is going. Those kinds of things are actually very helpful.
Yeah, I agree mostly to what Freeman and Juliana had just mentioned. I think if you already have your foot in the door for you already have a public health network, it is very easy to like kind of know what the companies are, what the organizations are, etc. If you're just starting with public health, like if you just got that interest in public health, you really just want to figure out your way through it. There's so much, it's very overwhelming. I think just start with like a basic search. Kind of just figure out from from the news, for example, like if you read health news, you can join like health newsletters that kind of will more basically kind of expose you more to the field of public health. I would say kind of see what, or start to notice what really interests you, what you really find yourself reading more, looking into more. After that, I will say like start to find companies or organizations that do the work that you're interested in. And from there, like if you don't already have a network, you can go on LinkedIn. If it's a specific university that you're interested in, you can kind of like find students from that university. If it's like, if you're looking into joining a specific university, doing your master's at that university, or like kind of have found different universities and want to know more about each, I will say like LinkedIn has been very helpful for me in both my university search and my job search. And I really like the feature of LinkedIn where if you go on a company page, if you go on a university page, you can kind of go to the people and it will show you like who you might have maybe are not directly connected to, but like who you have inside of your network some way or another. Like you might have a first, second, third connection with. You can reach out to those people and kind of say like, hey, I found XYZ as like a connection between us. Like I'd love to get to talk to you more. I know it's very overwhelming. I'm a very shy person as well. I find it very difficult to reach out to people, but once you start, just like once you reach out to like the first person or first two people, it'll get easier with time. You kind of start to like, know how to talk to people more, know how to approach people more. Some people may not even reply to you for forever. But I think don't let that stop you. Like reach out to people as much as you can. Get different perspectives from different people. Get different perspectives from like different people working at different organizations, people that went to different universities, people that are like in different fields. And I think that way you can start to kind of explore what you want to do more. And also I think one piece of advice that I do have that I myself have done in the future, I reached out to a person that I kind of know like personally, and I knew that she did her master's of public health. And that was like years before I wanted to go into university and do my MPH. And I kind of told her like, hey, this is my background. This is what I'm interested in. What do you feel like, from your experience, what do you feel like is the best thing for me to do moving forward? Obviously, one person can't make that decision for you, but it kind of gives you like a word of advice or kind of a push. They do know more, especially if they like have extensive experience in the field. They kind of know what is in the market right now, what is needed, and they can kind of guide you in the right way. But yeah, mostly just reaching out, networking, doing your own search. I know it is also time consuming, it is frustrating, but like one way or another, eventually you'll get there.
Thank you. There's some really good practical advice, and you're right, LinkedIn can be such a useful tool for many things, especially connecting with people. So I think it's really interesting that you brought that one in, because that's how we all got to know each other today. We used LinkedIn to get in touch. I'd like to move on to some kind of more career industry focused questions. I'd like to know, and this you can to do with your experience. I know you all have quite varied experiences. So either to do with your job or studies with public health. What are the kind of your favorite aspects of working or studying in public health? And what are the most challenging aspects, and how do you manage those challenges?
Yeah, so I think that I took a interest to public health because of the broader impact that I could make in population-based research. And I think that a challenge that I faced through my training was understanding we're very interdisciplinary in public health right now. So being able to digest information from a background in an area that is connected to my efforts, but that I don't have much knowledge about. So I think trying to diversify your understanding of how your collaborators are contributing to the goal of your program will be of good help to bring about the best result that you're seeking.
So for me, I would say my favorite part is getting to work with so many different people and having sort of cross-cultural exchange in my day-to-day work. I chose this particular job because I'm like I said, I work on multiple projects. So in the morning, I'll talk with people from Asia. In the afternoon, I'll talk to people from West Africa, and then I'll collaborate with really cool people who work with me in my job here. So it's just fun to be able to use different languages and like learn about different people, and then perhaps go visit them and just be immersed into their culture and just get exposure to how everyone else is living. It's truly, it feels like such a privilege and a gift. The most challenging part, I would say in this role specifically, and maybe in public health, if you work on the government facing side, and with donor funded work, is the delays that can happen, and the sort of like mismatching of priorities and values and interest. So for an example, like USAID, a donor wants to give money based on a US interest. They want to have a program based on a US interest. And it sometimes can feel, and as I'm describing this example, I would say this is a broad issue in sort of like international health or international development discourse, where you learn about it a lot in school, but US promoting something that may not be aligned with the community need or community interest, but because that's the money you have and you're kind of pushing that forward through your work, your research, your advocacy. So there's challenge in that. So it's really important as a public health practitioner to sort of, as best you can, advocate for the needs of the community and make sure it is aligned with whatever the program focus is. But because of that, there becomes like lots of delays, and it's a struggle to get buy-in from all sides and just sort of align and manage like expectations and priorities. It can be kind of defeating at times.
Yeah, I think for me personally, what I'll start with, okay, I feel like there's so much to talk about, but I'll kind of keep it short. So I think because my work has mostly been with like underserved communities, I feel like the main challenge was kind of understanding international differences in health and healthcare, whether that's political, cultural, like Juliana has mentioned, there's always that kind of organizations and companies are blinded to understanding the needs of the communities that they're serving, and they kind of want to focus more on their own goals and objectives. And I feel like as a public health practitioner, that's something, as Juliana has mentioned, you should advocate for. It gets very difficult to do, and it's like hard to talk about it. But at the end of the day, if you're working towards a certain goal, towards a certain mission, you have to kind of not just do what the company wants to do or what the organization wants to do, but really focus on what the community that you're serving needs. And I think something that I've really enjoyed working on is, again, like, because I work with global populations, it's really nice to just kind of explore different health systems, the different approaches to healthcare that different countries have. It's really nice seeing the different health systems and kind of looking at like how learning from different countries and how you can take pros and kind of implement them in different countries to improve the healthcare systems. Yeah.
Thank you. It's really interesting that you said that you can, in your work, you see how different kind of countries can share ideas and collaborate in that sense. I suppose you've also touched upon in things that could improve in the industry, which was one of the questions I was going to ask about. I think in any industry, there's always room for improvement. And you've all touched upon kind of aspects that could could be moved forward. How do you think that the industry can go about making those changes? What do you think would be kind of a practical way or a way that that could happen? Just out of interest, how do you see that improving and progressing?
So I think that I touched on how interdisciplinary we are right now in solving public health issues. So if working at a company, they offer workshops where you get to see how your collaborator contributes to the project, or the work that and knowledge and expertise that they use in order to be successful, and their contribution to the project. I think that at a company level, that would be very helpful in being able to create a better understanding between everyone who's contributing to the success of the project. So yeah, just offering opportunities where you get to see how others are approaching the same problem, but from their unique perspective, given their skill set. I think that there needs to be more communication and more transparency within the public health sector, as far as how we are each contributing a part to, the entire enterprise.
Yeah, I would agree with that. I think, yeah, for one thing, sort of building on what Freeman was saying about the transparency across and communication across, that's something that definitely could be improved on. Speaking from like donor-based work again, many donors sort of come in to they want to focus on a problem, take care of a problem. They all have different ideas or different ways of doing things, or just different motives maybe, and they sometimes duplicate work, and then it becomes exhausting on the receiving end, or doesn't make sense on the receiving end, leads to like fragmented care delivery. And so I sort of wish that like the power was distributed in a different way. Like it's really not about it shouldn't be about between donors competing for reputation or more money or something, based on the good work that they might do in an area. It really should be, the power should be rest within the communities they hope to impact. And so I think a shift would be, I know that like at least from the US side, they're trying to do like decolonize public health or like localization efforts. And those are really nice buzzwords, but I would really love to see that become true. And so meaning like kind of like Amani was saying, like making sure the community needs are elevated, and they're actually exchanging and being the leaders, they're being the experts, and they have enough resources to make decisions instead of the countries in power with the money making those decisions. But I would say for that to change, people like me would need to my job or my role in this area would change. So it takes a lot of like deep reflection about how to shift the power dynamics in this sector and in this work.
Yeah, both of you touched on really good points. I think just adding to that, like Juliana has mentioned, the whole decolonizing global health, decolonizing public health narrative has become very popular right now. But we really need to start seeing it being implemented. Like it can't just be a topic that's spoken about. You see organizations talking about it, but like not actually doing anything about it. And I think for me, one of the most, like, if I were to talk about one thing that I could or would want to see improved, is the sustainability of the projects or the programs that are being implemented, whether that's in the US, whether that's internationally, no matter where. I just feel like companies and organizations are like going in and like focusing on projects to help communities, but they're not being sustainable. And I think one of the main issues is, again, we go back to not focusing on the community needs, but then also they're not using the resources that are available in those communities, and they're kind of more or less focusing on what their goals are, what their objectives are. They're using the resources that they have. So like, for example, if we're talking about like a global health program or a global health project, they're going in, they're using the resources that they have. They're taking everything with them. They go, they like work on a community, and then they leave. And them doing that causes more harm than good, because you're only providing care, or like you're only improving like a healthcare outcome or a health outcome for such a short period of time, and then when you leave, it's going to go back to square one. So I think the public health world really needs to focus on how we can improve health outcomes while ensuring the sustainability of them remains. I think also like we've mentioned, we have to use the multidisciplinary field of public health as a way to do that. Yeah, I hope that made sense.
Yeah, I
Thank
agree.
you.
For monitoring and evaluation
Mhm.
of these programs.
They were really in-depth answers. I would really thank you for and also hearing kind of your different angles. You work in such different aspects of the industry, but by the sounds of it, there's such a running theme throughout all of those parts of the industry. So that's really interesting to hear. I'd like to talk about also kind of for students thinking about which jobs they might start off in an entry level, and how they might sustain a career within the industry. You can either talk about the industry as a whole, or your specific areas where you're going to be working or you work. What does typical career progression look like, and how could someone sustain a career in the industry from graduation right through until the end of kind of their working time? What would career progression look like within your part of the industry?
So that's a very complex question. So I'll approach it from a research scientist perspective, if that's okay. There's certain educational attainment that you have to have in order to increase the longevity and the furthest reach in a research career. A PhD student or PhD graduates have more career at higher level opportunities than a master's student, and so on and so forth, than an undergraduate student. So I think that if you're interested in pursuing a research career after undergrad or during undergrad, I would suggest interning or joining a research lab in your final year, or I mean, as early as possible, to be honest, because when you graduate, there is an expectation, which I think is unfair, of having gained a certain amount of experience now for entry-level positions. But I think the goal there is for you to gain that experience through internships that are offered at your university. Once you've graduated, maybe have 2 years of lab research under your belt. Try your best to participate in research that's going to be published within a scientific journal, within the community, that provides you with more capital, and it says that you are a productive worker. So that will make gaining an entry level position at either a biotech startup or a academic institution much easier. Once you gain that entry level position, I think it's and dependent upon the structure of the company, I would recommend joining a startup because you have much more flexibility in the role you assume, because in a startup, you're limited in your bandwidth and resources. So you wear many hats and you gain a lot of good experience very early on and build your skill set very quickly. And then you get to see a lot more than you would at a large pharmaceutical company. And so that will kind of inform that experience, maybe for 2 years, work for a biotech startup for 2 years, will inform what programs you will seek out for either your master's or your doctoral degree. And then once completing that postgraduate degree, a lot more opportunities will be open to you at that point, and you'll have to align your interest with, like I said, what the market needs. But you will have a lot more diversity in what direction your career can go in at that point. It's just kind of like what it is that you're looking for.
Yeah, totally echo what Freeman is saying, and it is great to hear the research science perspective. And building on that, I feel like we have neglected to mention, or we have talked about how far-reaching public health is. And just to note that a lot of people I met in my MPH degree started off as doctors or healthcare providers. So that is a route you could take if you study the hard sciences in undergrad. You take up a healthcare profession and then you pivot into public health, or just use it as a way to complement or sort of emphasize or open up your opportunities. That's the way to go. For me, coming from a background without the data science, without the biological or life sciences, I would say it's easy to get into, or easier to get into international development firms like an RTI, Chemonics, or if you, I'm saying if you want to pursue the contract funded sort of work, research work, and become, I guess, work in donor funded global health, is that you could start at those firms as an analyst level, and that those positions are typically more administrative based. You need to have some understanding of global health, or of the topic area, but you can learn on the job. But at that point, you'd be supporting the higher levels with organizing meetings, collating information, doing some research, things like that. And then you can move up to the associate level, and then beyond that, you become like an advisor level. And sort of like Freeman is saying, it really does matter. The educational attainment here does matter. And so in these sorts of organizations, you might not reach, you can't reach to a higher level unless you've gotten your master's, or and then beyond that, unless you've gotten your PhD. Sometimes just plain experience can get you there, but that's not, that's more the exception. It is sort of like getting you prepared to go into a graduate degree and then come back out and be sort of like an advisor or a leader. And I will say too, I've talked a lot about global health, but if you do want to focus on US-based public health, there are some like fellowship programs you could do outside of undergrad. Like the CDC has a fellowship program for young people, because it is pretty difficult to get a job quickly out of undergrad if you don't have like publications or like sort of a science background or those like hard skills. So if you come from a more liberal arts degree, you would probably need to start in a more like administrative background.
Yeah, I think just to add, it really does depend on like what your background is coming in. And then also what ideal role you'd want to have later on in the future. It is like important to note that public health professionals work in like various settings, whether that's like government agencies, nonprofit organizations, hospitals, academic institutions, research, et cetera, et cetera. So I think like Freeman and Juliana mentioned, internships and fellowships can be really helpful in kind of seeing what you're interested in. And that can really help you kind of decide what you'd want to do with your career. And you can always switch between throughout your career. Like I know some people who have started in public health as something and are now doing something completely different. So yeah, just like kind of experiencing with what you want and then taking it up from there.
Thank you. It's interesting to hear the progression or the different aspects of education that are really useful within your field. So I think this is it's different from what we often hear in other fields. Often the experience comes before the education. So I think it's really interesting to hear that in this field, the education is actually really useful and really important. And before we move on to a student question, I have one more question kind of to do with your career and your work. But I suppose it's more of a practical question or personal question. What would be 2 skills that you think would be really useful to have within your industry? So it could be maybe a skill, maybe something you've learned or something the person might be like, but what are 2 good skills or personality traits to have in your field of work?
I feel like it's unfair because I get to go first. So I'm only going to list one. I think it's really important and I know it's really hard, but public speaking, I think it's really important for you to be able to clearly communicate your work to individuals who have the same sort of background that you have, but also who are completely new to what it is that you are disseminating to them. So I think just the comfortability, but also knowing how to tailor your messaging to your audience so that your message is received. Because I feel like a lot of times we communicate and it's not as useful as it could have been because it wasn't tailored to the audience members. So ensuring that you're doing that.
Yeah, I was gonna say persuasive writing. So basically written communication and the same idea that Freeman is promoting, that you want to tailor what you're saying really well to an audience so that it gets across. And written communication, like because everything is online and digital, writing posts on LinkedIn even, or writing an advocacy brief or writing a grant to get funding, it's super important to be clear, concise, and know your audience. And then I would say a personal skill is it's important to be adaptable and flexible, to be able to learn on your feet really quickly, adjust on your feet if you're going to a different setting and having to assimilate there.
Yeah, and then just to add to that, I think public speaking, communication, and then also analytical and research skills. I think at the end of the day, public health is a very data-driven field, and the ability to gather, analyze, interpret data is very important, no matter what field you're working in. I know it is very hard to go into a research field without having like previous research experience. But if it is something that you're interested in, I think it's important to start focusing on research just a little bit more, just because public health is a very, very data-driven field.
Thank you. They're all really interesting traits or experience to have, absolutely. And we have time for one very quick question. The final question is a student question, and it's a really nice one to finish on, actually. What is one piece of advice that you would give to your younger self with the knowledge you have today or the hindsight that you have today? What's one piece of advice you could give your high school self?
So I would say, God, I would say definitely like stay present, and the journey in your training, there's going to be ups and downs, and the mistakes are good. The mistakes that you make are good because they're great learning experiences. But don't shy away from taking on new projects out of fear of making mistakes. Be confident in that you're going to be able to do your best. And if something doesn't work out, you will have learned something from it, and you'll be able to implement it in the future.
That was so lovely. Yeah, I was gonna say mine's a bit similar. It's don't be afraid to pursue opportunities that look interesting, even if they seem out of reach. Like, just be surprised about what you can get if you ask or go for it. I feel like I let some things pass me by because I didn't think I was qualified, but it's so important to be confident.
Yeah, and I think for me is building a network from the start. I think that was something that I lacked from like when I first got into the public health field, or when I first like came here for undergrad. I think don't shy away from reaching out to people, don't shy away from like talking to professors, reaching out to like people that you meet at different networking events, like really just staying in contact with the people that you meet here and there, because you never know when you can like maybe want to work with them in the future. You can I don't know, there's just so much that you can like take advantage of from your network. And I think it's really important to not shy away from the beginning and kind of stay in touch with the people that you meet throughout your career.
Thank you. That were really great pieces of advice. And definitely, Juliana, as well, I resonate with the, you like something, you apply for it anyway. You never know. You can't miss out by just applying. So it's actually so true. We have come to the end of our time today. I can't believe it went so quickly, but thank you so much to the panelists for joining us. We had really, really interesting discussions, and I love to hear all about the industry, the bits that are great, the bits that can be improved, because every industry has aspects which can improve going forward. So it's really, really great insight into your careers, into what you've studied, and I'm sure the students would have had a really good opportunity to hear about the options after university, as well as what they might want to study during university. So thank you for joining us and being so open and honest with us. For the students, we've put the contact details of our panelists in the chat function in case you think of questions after the panel. They're happy for you to contact them that way, so make a note of those now. But otherwise, thanks so much for joining us, our panelists. I hope you all have a great rest of your days. And thank you. Yeah, thank you for your time.